Great. Hi, everybody. Welcome to Boone County Hospital Foundation's monthly program, Educating and Empowering You, where we try to provide a health topic that's related to a lot of different opportunities for health improvement. And by doing that each month, we are providing that out to the community and also through video. And then also we have switched over to also provide through our podcast format. So definitely take a look at our website, boonehospital.com, right? Rachel's, I'm looking at Rachel. Our email is .org, so I always have to think about that. But boonehospital.com and go to the foundation page and you'll find all kinds of information about educating, empowering you, and all the things that we're doing through the foundation. So I'd like to welcome you all today to our program with Medicare Options Made Clear with our friend Shiloh Burke, who's going to introduce herself and share a little bit more about herself and then also what she does, and then obviously helping us continue to muddle through all these Medicare questions and changes that can come down the pike each year. So I, first of all, want to say thank you for being here, Shiloh. Thank you for sharing your knowledge and your wisdom. And I'm going to go ahead and just turn it over to you to get us started, if that works for you.
Absolutely.
Awesome.
Hi. I hope everybody can hear me. Thank you for having me today, Sarah. And thank you to those of you that have joined me. I'll try to make this as riveting as I possibly can make Medicare. It's not exactly the most fun topic for most. I happen to love it, but that's just me. So a little bit about me. I have my office uptown in Boone. I'm always there to answer questions pertaining Medicare insurance. I'm happy to help in any way I can. I'm usually there by appointment, so go ahead and give me a call and I'll make sure I'm there for you. We have an office in Polk City as well, where my husband's uncle and cousin are. And I'm in and out of there some too. So you can find me either one place, but I'm happy to help. Any questions you have, feel free to call because I know it's overwhelming. So we will get into this super fun program of Medicare Options Made Clear. Let me see if I can click through this. Here we go. There we go. There's just my little logo, my phone number, 515-230-2042, and my picture, who I am. You may have seen me at the Viaduct this year. I have a billboard this year, which is kind of fun. And calls may be recorded. So I just wanted to touch base on that, and I was afraid I would forget if I didn't put that somewhere in a slide. So the Center for Medicare Services has a new rule this year, and it's effective October 1st. There's still a lot of questions about it, but if you call an agent like myself, or they call you, depending on what it's pertaining, the calls may be recorded. So there's going to be a little spiel, all that. So that's just something new we're all learning to navigate this year. So if you do call me, I'm not exactly for sure how incoming calls are going to work. That's still a little hazy. Hopefully we get it figured out by October 1st. We're going to do the best we can. I've joked that I may just put my phone on speaker and buy a cassette tape player and record like the old fashioned. Not really. I'm really hoping we can come up with something better than that, but it's tempting. It's tempting. So that's a little thing about what's new in this year. So we'll go on to the next slide. What we will be going over today: Medicare basics, Medicare options, Medicare supplement versus Medicare Advantage plan. We all see those commercials with all kinds of famous people on them promoting their product. You know, it can be very, very overwhelming, and there's no one size fits all. So we're going to just be going over the basics today. This is not plan specific. This isn't a sales presentation. This is purely educational, just to help you understand when the time comes with open enrollment, how to approach your options, because it's very overwhelming, and there's a lot of moving parts to Medicare, and you want to make sure you have the best care available to you. So that's what we're going to be going over today. I'm happy to answer questions on here, or like I said, feel free to give me a call anytime. I love answering questions. I love helping. So there's never, ever It's just, I just love answering questions. So even if you think, oh, I hate asking her that question, I feel stupid asking it, please don't ever feel that way because it's so overwhelming and I'm happy to help. So we'll go on to the next slide here. This is just on your little Medicare card that you get, the red, white, and blue card. It says Part A and Part B. A lot of people just know there's parts, they don't necessarily know what they cover, don't cover. So I just wanted to share a little bit about that. Part A helps pay for hospital stays and inpatient care, where Part B pays for doctor's visits and outpatient care. A common misconception that I hear is I don't need anything else. I have Part A and B. Some people go that route, but there's Part A and B don't cover everything. And that's why it's so important to look into getting that extra coverage that you need. I often tell people to think of Medicare as a road, and Part A and are great. And if you think of Part A and B as the road, know that there's going to be some potholes in that road, and that's where supplements and advantage plans come in into filling in those potholes. Just to cover everything and make sure that you have the best coverage available to you. So that's what Part A and Part B is. I did add in here some enrollment periods just to go over. I won't go over everything with these because this seems like sometimes the more that I talk, the more confusing it can be. But initial enrollment period, that's usually when people are turning 65. You have a 7-month window, 3 months before you turn 65, through your birth month, and to 3 months after the month you turn 65. So that's the initial enrollment period. Annual enrollment period, also referred to as AEP, which I'm sure you have seen tons of commercials talking about AEP, and it's going to ramp up even more next month. That is October 15th through December 7th. And that's more the general time that you can make a lot of changes to your Medicare Supplement, Advantage plans, whatever you choose to have to help extra. That is the period that we're coming into that most of the changes take place. We also have the open enrollment period, also referred to as OEP, and that is basically to move from one Medicare Advantage plan to another, and that is January 1st to March 31st. Then we have a special enrollment period, and there's several different special enrollment periods. If you move, depending on where you're moving from, sometimes that can be a special enrollment period. Sometimes there's weather circumstances that's a special enrollment period. There's several different special enrollment periods. So like I said, that's something where you'd want to meet with someone, an agent somewhere that would know and go over all of your options and what enrollment period would be the best one for you to make a move if you need to. So that may have confused you more than helped, but it just, when they talk about enrollment periods, at least now you have a little bit of information on that. So now we're going to talk about our options. So we talked about what Part A and B cover, and then you hear people talk about option 1, Medicare supplements. So you have A and B, and from there you have 2 different options. The first option we're going to talk about is Medicare supplements. So that is where you usually pay a premium for these. You would have your Part D plan, and that would help pay for prescription drugs. You can also add supplement insurance, Medigap, and that helps pay some of the out-of-pocket costs that come with original Medicare. So Medicare supplement, you're going to be paying premiums for, and that's going to help fill in those potholes in the road left by Part A and B. So that is option 1. It's a great option. I have a lot of clients on Medicare supplements. But I'm going to say this over and over again, there's no one size fits all. When people say, well, which route should I go? Should I go option 1 or option 2? It's completely up to the consumer. There's pros and cons to both. It's just whatever your personal preference is. So that is option 1. Excuse me. I guess I'm not used to talking all this once in a spiel. Option 2, Medicare Advantage, and that's probably what you see a lot of. I think Joe Namath maybe is, I don't know, all these different famous people on TV talking about Medicare Advantage plans. And that's your other option to fill in the blanks that Part A and B don't cover. This combines original Medicare, Part A and B coverage in one plan. Usually it includes prescription drug coverage. There are a few plans that do not include prescription drug coverage. And that's just something that there's certain circumstances where you would not want prescription drug coverage, such as if someone was on TRICARE, you wouldn't want something with prescription drug coverage because that has the potential to interfere with that. This Medicare Advantage plans may offer additional benefits like vision, hearing, and dental coverage. So it's just a totally different route to go than the supplements. And that's something at Consultations. I think the best way to approach that is to do a side-by-side scenario, and then you can look and see which option's the best for you. So that's your option 2, Medicare Advantage plans. And I also have booklets in my office if anyone ever would want a booklet that pretty much goes over all this. So I'm happy to set a time up to get you one of those too, if anyone would like one. So let's go Medicare Advantage. I get a lot of people say, well, isn't that new? It's actually been offered for around 25 years and has been growing in popularity. So it's just something, it's not new. It's been around a long time. So just something to consider there. Again, and I say this over and over and over again, there is no one size fits all when it comes to which option will work best for you. That's why it's so important to meet with a local agent that can walk you through all your options to find the best fit. You know, educate, and see which option's the best for you, because what is best for your neighbor may not be the best fit for you. What's even best for your spouse may not be the best fit for you. It's very specific and should be very tailored to you and your needs, what medications you're on, all those things. It's a very, very specific process. So what is perfect for one person may not be perfect for the next. So it's just something to really consider when it comes to this. Is there really is no one size fits all. I have family members on one plan and others on others. So, you know, it's personal preference, and it's what's the best option for your specific needs. And I always recommend meeting with a local agent that can walk you through all your options. That's just my own little bit of advice. I always try to promote local if possible. What if I try an Advantage plan and change my mind? That's another question I get, because change is hard and it can be overwhelming. So you do get a one-time trial right period. It's essentially a one-time 12-month period to try out a Medicare Advantage plan. And within that, you could, if you chose, it's just not for you, you can go back to a supplement, which was that first option we talked about without the underwriting. After the 12-month period, most people would go through underwriting unless there was some special circumstance. But essentially, you would have the 1 month or one-time 12-month period to try out a Medicare Advantage plan that you could go back into a supplement without going through underwriting. After that, you would have to go through underwriting to go back to a supplement. But it's nice that they give you that one time to try it out. And I have a lot of people that have utilized that, and it's just a great option to try it out. It's kind of like renting a car before you buy it. See if you like it, see if this is going to work for you. If not, you have your option to go back. So I really, really appreciate that they have that option. We'll go on to the next slide. Do I offer complimentary consultations? Absolutely. I love to meet with people. I love to do one-on-one visits with you. My office is uptown, like I said. Please feel free to give me a call just to go over options. I'm happy to answer any Medicare insurance questions that you have. So yes, absolutely. Absolutely, I do. What happens during a complimentary consultation? We would go over your Medicare needs, go over prescription drug lists to compare Part D plans, and then compare supplement and Advantage plan options. I really enjoy talking about Medicare, almost to the point where I think sometimes my family gets sick of it because they'll see a commercial and if they ask me a question, they get an over-explained answer. So it is what it is. But I really like being able to help people find the best option for them. So yeah, that's what we do during the complimentary consultations. Oh, and I usually have a candy bowl on my desk. So just know if you come visit me, you're going to get some treats too. And I'm here for you year round. I'm not just here during enrollment periods. I'm here year round and I'm happy to answer any Medicare insurance related questions that you have. And there's my phone number again. So I know I kind of buzzed through that, but I'm happy to answer any questions you have.
Yeah, we can open it up if anybody wants to unmute to ask any questions or type it in the chat. I did have one question for you that came up for me as I was listening, and I was joking in my own mind thinking, oh, hey, I have 20 years to hear this 20 more times, and and it probably will
Yes.
still be confusing, right? So I know that that's really kind of the gist of it today, is just to really invite people the opportunity to, to do the free consultation with you, check
Yes.
things out, ask questions, find out
Yes.
how this works. I mean, and actually I kind of have two parts to my question.
Absolutely.
Do you use, I'm kind of assuming that there's like a program or software that you kind of plug in information
Yes.
into and it spits out what the information is that you need. It's not, yeah.
There absolutely is. I have a couple different programs that I use. The first one is Medicare.gov that anyone can go on to, and you can plug in your prescription drugs, all that. And then I have one that I use that is through one of the companies I work with, and I can put in all the information. It gives me all of the cost sharing information that someone could incur. It's really fabulous, and it can really help assist us in deciding what is the best option.
Okay. And so along those lines, when you're getting this information, you're also bringing in the most cost-effective options and opportunities for
Absolutely.
those people as well. So it's not like
Yep.
you're with one insurance company, you're
No.
looking at all of them.
Correct, correct. I'm an independent agent and I am contracted with, I believe, all the major carriers that I can think of in the area. So yeah, I really take an approach where I look at the big picture and I look at all of the companies that we can work with and see what's the best plan. Because like I said, what is best for your neighbor or spouse may not be best for you, especially when it comes to your medications and getting the best coverage there. It's so important to tailor a plan to your needs. So, yeah, I'm independent, so I look at the whole picture.
Yeah, great. And my one last question was, what do people bring to the appointment when they meet with
Um,
you?
at the appointments, usually people bring their Medicare card. Just it just makes it easier if you do decide to change something. If someone's on Medicaid, I would have them bring that card because there's different programs available for that as well. I would also ask that you bring a current medication list. The ones from the pharmacy are best because it's a little bit more specific, but even I've had people bring in a bag of their medication and that works too. We can go through it. It's fine. So we'll do that and get that all punched in. I also ask that you bring a doctor and facility list, just so we can make sure everything's going to be covered the best for you. So that's what I ask that you bring in to your consultation. Usually I like to meet with people a couple times because I find that there's a lot of information that I'm going to throw at you. So usually it's best to kind of have an initial consultation, give you some information, and then come back and let it absorb a little bit. I know that that's kind of how my brain works a little bit. Sometimes I go home and I think of different questions. So, I'm happy to do whatever works best for people. So,
Yeah, great. Well, and that makes sense. I mean, I would imagine that oftentimes it doesn't all get resolved in one visit, but you brought
correct.
up medication cards, so I just wanted to make a plug for the foundation. I did pull one out because I wanted to see what all we had in here, but we have a Boone County Hospital Foundation medication card, and then the paper version
Yes,
of it. So it has the
perfect.
medication data and allergies, vaccinations. So we obviously added COVID in there, and then any medical conditions, emergency contact information, and then it actually does talk a little bit about the do not resuscitate, advanced directives, living will, power of attorney, and all that on there as well. So if you need some of these, anybody here, or Shiloh, if you want me to get you a stack of those to hand out to your folks,
Yeah,
I'm happy to share those as
absolutely.
well. Um, I know that there's a way to also store this information on your phone, I think under your health app, for people who do use smartphones, but I know a lot of people still like the paper because we can, erase it and do all that fun stuff and just have a tangible little card that we carry with us. So, yeah, so if that's helpful, that's something that the foundation also offers. So,
Wonderful. Wonderful.
that was all the questions I had. Did anyone else who is live here have any questions they wanted to offer in the chat, or um, just unmute yourself?
This is Darla, and I do have a question. Um,
Yes.
it was kind of brought to my attention, uh, and I don't know if this is true or not, but i- if you're if you're going to get, an addition to your Medicare, that a supplement is better than a replacement because some of the replacements aren't too great.
And that's where it's very tailored. I have some people that have been very happy with replacements and will definitely stay with the Medicare supplements. And then I have other people that love their Advantage plans and would never have a supplement. So, I don't think that one is better than the other. I just think it depends on your circumstance.
Okay,
Yeah.
I just know as far as in the hospital, sometimes it's a little harder for like payment and stuff like that.
And not all Advantage plans are created equal. There's some that I would recommend over others,
Yeah.
for probably the reasons that you're saying. I can't get
I'm
into
trying to
plans.
be politically correct.
Yes,
Okay,
yes.
say
No,
that.
I understand. And there's some that I think are better than others in that aspect. But yeah, that's where we look at the big picture. And I only work with carriers that I would have my own family members under. So
Right, right.
yeah.
And is there like a ballpark figure of what a supplement would cost? Or is that just too
Not
varying?
really, because it really depends on your age, your zip code, all of that. So but please give me a call because I could give you a ballpark for you specifically over the phone.
Well, but you cannot get this until you're 65, correct?
On Medicare. So you can be on Medicare, correct, when you turn 65, or if you have certain disabilities,
Okay,
you can be on Medicare. Hmm.
okay.
Yeah.
Thank
Yeah.
you.
But I always encourage people, I have a lot of people that meet with me the year before they turn
Right,
65,
right.
just so it's not so overwhelming and just so they can come up with a plan. So yeah, I'm happy to meet with anyone at any time.
Okay, thank you.
Yeah, thank you.
Questions?
Yes.
Anybody else out there? Did you think of anything else, Shiloh, that you wanted to end with, or?
Not, not that I can think of.
Okay,
No, I think we covered most of the basics.
great.
Yeah.
Well, and like what we said from the beginning too, I mean, this was an educational offering, and I think even Darla kind of highlighted that there's going to be a lot of opinions out there, you know, from neighbors and that type of thing. And
Yes.
your message, it sounds like today, if nothing else, it's that it's very individualized. It's, you know, no two plans are going to be the same, not your
Right.
neighbor, not your spouse. So it really is important to sit down and meet with a professional who can really
Yes.
help
Yeah,
you kind of muddle through that process. So, okay.
absolutely. Because it's overwhelming and it's a lot.
Yeah, yeah, it is. And I think I'm finally starting to understand this after hearing it for, you know, at least 5 years now. So, but thank you for being here. And just a quick
Yes.
plug again for the foundation. We're working on our October EEU. We're hoping to do women's health as our program, but all our physicians are really busy right now. So I'm trying to track one or two down to help us do that program. So keep your eyes and ears peeled for that for next month. But thank you, Shiloh, for being here for us this
Yes.
month. And October 15th through December 7th is the enrollment period, but people can call you anytime before that.
Absolutely. We can release the new plans on October 1st. So
Okay,
something to think about too.
great. Wonderful. Well, thank you so much for being
Yes.
here. Thank you to everybody out there for being a part of our talk
Yes.
today.
Thank you. Thank you for
Okay.
having me.
You're welcome. Take care. Bye-bye.
Yep. Bye-bye.